Hi, my name's Stephanie and I'm going to be your nurse today. Can you please state your full name and date of birth?
Kendall Miller, 2/21/02.
This is the correct patient. Can you please tell me if you have any known allergies?
I do not.
And what pronouns would you like to go today?
She, her.
Okay, today we're going to be doing a focus assessment. It should take between 5 to 8 minutes. Let me know if you have any questions or concerns.
Okay.
Patient understands the purpose of the exam. I'm going to give you this robe to put on. You're going to tie it in the back. Do you feel comfortable with the temperature and privacy of this room?
I do.
Patient is comfortable and prepared for the exam. I'm just going to begin with asking a couple questions. Have you had any difficulty in your ability to move lately?
No.
Have you had any changes in your muscle strength?
No.
Have you had any trouble doing day-to-day tasks?
No.
And have you had any pain with your bone, joints, or muscles lately?
No.
Patient denies any neuromuscular abnormalities. If she did show any signs or symptoms, we'd use Elkhardt's ICE assessment and age-appropriate assessment tools. Okay, so I'm going to have you stand up for me. Just going to look at your posture. Patient is able to stand with balance and erect. Knees are in line with hips and ankles, and the body and limbs are symmetrical and proportional to the body. Okay, so now I'm just going to take a closer look at your back. There's no abnormal deviations of the spine. There is the lumbar, cervical, and thoracic curvatures present. The shoulders and hips are symmetrical and level. The spine is straight and the vertebrae are aligned. Okay, so now I'm just going to have you do a couple tasks for me. Let me know if you have any trouble doing any of them. I'm going to have you bend forward at the waist, bend back at the waist, bend to the right, bend to the left, turn your trunk to the right, and then turn your trunk to the left. Did you have any troubles?
No.
Patient is able to do range of motion without any pain. Now I'm just going to gently palpate your back. Let me know if you feel uncomfortable or any pain. You good? Okay, patient has no pain upon palpation and spine and neck are straight. So now you're going to sit back down. I'm just going to take a closer look at your arms and hands. Muscle is generally symmetrical. There's no atrophy noted. There's no twitches or spasms noted. I'm just going to gently palpate your shoulders and arms and hands. There's no pain or edema upon palpation. There's no redness. Joints are symmetrical. There's no edema and there's no enlargements of the joints. Now I'm just going to use the back of my hands to go along your arms for temperature. Temperature of joints and muscles are uniform and there's no increased warmth along arm. Now I'm going to have you hold your arms out straight and bend at the elbow at 90 degrees. And I'm going to just push down and up. Let me know if you have any trouble. Okay, tricep strength is 5 out of 5 and equal bilaterally. Did you feel any pain?
Nope.
There's no pain noted. I'm going to have you hold your hands out again and bend at a 90 degree angle and resist my force. Bicep strength is 5 out of 5 and equal bilaterally with no pain noted. And now I'm going to have you grip both of my fingers. Grip strength, you're good. Grip strength is equal bilaterally. Muscle strength is firm with full flexion of the fingers. And now I'm going to take a closer look at your lower extremities, such as your legs, knees, ankles, and feet. Muscle development is equal bilaterally, and there's no atrophy noted. Feet are straight and aligned with lower extremities. Toes are straight. Toes are extended and straight on both legs. Now I'm just going to gently palpate. Let me know if you have any pain. Did you feel any pain?
No.
There's no pain upon palpation. Now I'm going to use the back of my hands to test for warmth. Muscle and joint warmth are uniform bilaterally. There's no increased warmth along the leg. Now I'm going to have you extend your feet out for me. Both of them like up. You're going to sit back on the chair. Now resist my force pushing down. Good. And now you're going to bend your legs at a 90-degree angle down. And then resist my force. Good. Muscle strength is 5 out of 5 and equal bilaterally. There's no pain noted. And this concludes the assessment.